Good morning, guys. I hope we're all sparkly. Apologies for the lack of videos recently, but I've been busy. Busy doing what? Well, work is incredibly busy, and my focus of attention is what? It's towards my patients. I don't really like social media. In fact, I hate social media because nothing good comes from it. Doom scrolling. But it's a necessary evil. And I've had some complaints that I've not done a video for a while. So I'm going to do a video. I have to be in the mood. And I'm in the mood right now because I've just had an email correspondence from somebody who thinks I don't care anymore. I care. But I give you what you need to hear. Realistic expectations, because that's what you need. Goal setting, yeah, I'll help you with that. I'll help optimize your male androgen levels for long-term physical and psychological well-being. That is my job. My job is to get your levels where they should be to allow you to do what? Yeah, 1 minute, 15 seconds. Go earn your reward. Ultimately, it's your responsibility. The process here at the Men's Health Clinic is very structured for a reason. We do bloods, we talk to you when we can help you. We provide you with all the necessary information to allow you to make an effective, informed choice as into what you should do. There are no hidden costs. There are no nonsense. You'll feel amazing all the time. Now, your subjective experience is your subjective experience. Objectively, having seen around 4,000 of you, I'm pretty sure we know what we're doing. So place your confidence in us. And as we've said before, trust the process. It isn't an overnight fix. It takes work. It took you how long to get to this state of low testosterone? Without a pathology, it probably took you many, many years. You're not going to undo all those wrongs in 3 months. You might, but you're unlikely to undo all the wrongs in 3 months. The process takes time. So as we said before, you have a drug effect, you go on testosterone, and hopefully in the first couple of weeks, you feel amazing. That's peak trough, peak trough, peak trough of the HCG, having that neuroendocrine effect. Conversely, you might feel anxious. Suck it up, buttercup, because it's a rite of passage to get you where you need to be. And as I said in another video, then the testosterone builds up more slowly. It's much like a graphic equalizer. The low testosterone is perhaps the most important part. That's the base. The base is down at 0. Naturally, all those other levels, the treble would come down because you wouldn't listen to the music in that disharmonious acoustic state where the bass is down at 0 and the treble's up at normal. You go on testosterone and we're artificially raising that bass back up to normal. And again, we're doing that through administration of testosterone and HCG, hormone replacement therapy, not testosterone replacement therapy. Then your body has to adjust naturally. So you are in a state of change. You may not feel that subjectively. You may feel that subjectively. But objectively, we need to get you to healthy hormone levels to allow you to do what we've said 1,000,000 times before. So I'm regurgitating the same information in just a different way to drum it into that head. I had a patient the other day, been stable for many years, and then he got high estradiol. And that's my fault, apparently. No, it's not my fault. He didn't make it as my fault. But again, high estradiol compared to testosterone isn't going to make you feel very good. It's going to make you feel anxious, emotional, and upset that you're no longer balanced on testosterone replacement therapy. You've got to go through that process again. You are going to change your medication, and that's going to have a drug effect. Now, paradoxically, when you take an AI for the first time, you can feel worse. That's weird, isn't it? We're giving you a drug to make you feel worse. No, we're not giving you a drug to make you feel worse. We have a drug effect before we get the true effect. And the true effect is stability, with the understanding that microdosing TRT allows for the natural peak trough that happens as a day day basis. Diurnal variation. Peak in the morning, trough in the evening. So why can you feel worse? Well, if you're going to lower estradiol, you're also lowering serotonin, the happiness, contentment hormone. So that doesn't make any sense, does it? We don't want to have lower levels. Well, the body survives on the concept of what? Balance, baby. Balance. You want to have balance to allow for subjective appreciation of subtle changes in physiology. Because if you feel good all the time, you can't feel good all the time. It's not about feeling good all the time, because the body survives on the concept of what? One more time, balance. It's yin yang, baby. And that's the whole point. So we get you to healthy hormone levels to allow you to decide in the morning to say, right, today's going to be a good day. You want to be able to appreciate the highs and learn from the lows. To move forwards, again, Carl Jung's shadow. The shadow is always behind you. You decide to move forwards towards the light. So the process takes time. The process is fluid because your physiology is fluid. I saw my orthopedic consultant the other day, and I've got degenerative tear in my medial meniscus. He said, Rob, you've got mental resilience, you're strong, but your joints are your joints. Now, saying that, testosterone and estradiol especially is going to help lubricate the joints, but really your joints are your joints. So there's always going to be a weakest link. And what should we be doing? We should be working to be healthy human beings. Animals don't think about their testosterone levels. They don't think about anything else apart from surviving and getting on with what they need to get on with. Now, we live in a very perverse world. We're now interested in testosterone. I don't want you interested in testosterone. I want you cracking on with life. I want you to place your trust in us, and we will advise you objectively as into what you should do. As I said, your subjective experience is personal to you, and mindset is such an important part of that. We need to work on mindset every day, because time waits for no man. Time is right now. But I want to feel good how I felt in the past. The past is gone. The future is the future. Lao Tzu, as we've said before, depressed man thinks about the past. The anxious man thinks about the future. The happy man, happy, there's no such thing as happiness. The content, peaceful mind needs to be paradoxically moving forwards. Taking a day off, the most absurd concept in the world. We did a spa day many moons ago now for the clinic. Kill me now, because we did nothing. We went from sauna to steam room to jacuzzi. It was torture because I wasn't productive. Testosterone, dopamine, reward. Men are reward driven. We don't take days off. We say, what can I do today to make today a productive day, to make today worth it? There are no days off in Mother Nature. We are simple creatures with simple needs. Testosterone, dopamine. Get on with it. Put yourself through that level of adversity that you understand that the reward is an illusion and the effort is the reward. The outcome is very much secondary to what? Right now, being 100% present in the moment, thinking about what you can do, what you should do to be a better version of your current self. We are striving to improve all the time. That's what you have to understand. Most of my patients come for their annual review and say, I don't even think about TRT anymore. And we have a little chat, we put the world to rights, and we say, crack on. If anything changes, obviously do bloods. Then I can have the quantitative markers to effectively advise you alongside your qualitative symptoms. Because not everything's TRT. Not everything is TRT. TRT is incredibly important, but there are other things going on. Is your sore throat because of low testosterone? No. So work with somebody that will give you realistic expectations, advise you appropriately as in what you should do, but ultimately the responsibility is whose? Yours. To do what? Yeah, you guessed it. Go earn your reward.